Good morning. I'm Michael Turturro. I'm the Chief Nursing Officer for the ambulatory clinics across Central Texas. It is a large faith-based hospital system that's comprised of about 50 hospitals and over 500 clinical areas. My responsibilities are for the Central Texas area, about 29,000 square miles, divided into 5 regions. Of those 5 regions, we have about 425 clinics that I'm responsible for. Now, this is a matrix system, so we have to work together as a team with our regional CNO, who's over the acute and has jurisdiction over ambulatory. But my focus in this system is to work with ambulatory to bring them back into the fold. When I started this job about 2 years ago, I tried to get into what the dynamics of the teams were in each of the clinical areas. Many of them, because it's so geographically separated across Central Texas, many felt disjointed, that they were located so far out that they weren't even part of the system. They didn't have a voice, they didn't have a name. There was no way for them to get their desires across on how to improve patient care. Now, as I mentioned, this is a faith-based system, so everybody that comes in values our mission and our vision as to being able to be the best healthcare system, taking care of our patients across that part of the country. So with that, my goal was to how can we bring them back into the fold? How can we improve the relationship between leadership and these nurses? So one of the things I looked at initially was I wanted to give them a voice. So we were beginning our Pathways to Excellence, and we began having all of our council meetings, and we have a staff meeting council, we have a managers council, and I made sure each region had a representation or a representative on the board so that they can express their feelings, their desires, and how they feel they can improve their region. That was the first thing. Second thing, I wanted them to feel important. I wanted them to function at the top of their license and realize that they're not just going through the day just checking off widgets and blood pressures and tracking patients, that they truly could function at the top of their licensure. And the way to do that is to get certification. Many of them were not certified. So I began a ambulatory care certification study group. And we brought it up. It was one night a week for 10 weeks. We took all of the chapters in the core manual, we took all of the PowerPoints from previous study groups, and we spread them out over 10 weeks, and it gave it to them in small bites. We sat there together, we talked about the material, we did practice questions, and of the 25 that took my first class, 17 have already passed their exam. And now the second class is going right now. I have 35 nurses in the second class. So our goal is to raise the percentage of certified nurses in ambulatory as high as possible. I've even got other regions now also doing this separately in their region. Of course, because we're geographically separated, they can't travel. I did have it set up on WebEx so people could call in and listen, and they could monitor it on the computer screen, all the questions and things we were putting up there. But some of them wanted to do their own internally, so it inspired them to start doing this on their own also. So I thought that was great. Other things we're doing to inspire my nurses and to improve the feeling in ambulatory is we started our own ambulatory newsletter. Each region, every quarter, submits information about what's new to their areas, new construction, new nurses that they've hired, new certifications, new degrees that have been earned. It's all a positive. It's all giving them recognition and allowing them to, again, voice their opinions and how they feel on all the positive things happening in their region. So in addition, we talked about a newsletter that we've begun. We talked about certification. And one of the other biggest things is, in the past, my predecessor maintained a monthly nurse manager meeting, again, to try to link all the regions. But it was always done in one location. Everybody had to call in. That doesn't work. When you want people to feel involved, they have to feel important. In their region, maybe 2 hours away, is just as important as the main area. So because of that, I took the meeting on the road. We took it on the road, and we went every month. We go to a different region. I take my little troop with me, and we set up a WebEx so everybody else can call in, but I allow them to host the meeting. They provide snacks if they want. We talk about the important things that are going on in their region. But the key is what are we doing differently in each region that we can share? How can we take something from one region that's been improved, a process, a workflow, and share it to another region so we're not reinventing the wheel all the time? That gives them value because they feel the work they did is so important that we can adapt it across our entire division. So that's one of the positives that they love, and they get so excited when we go there to be able to do that.